Hi, I am Jane Marks and this is From the Heart. Across the country, students are returning to school in person for the first time in more than a year. With the surge of COVID cases and new concerns about the Delta and Lambda variants, families must be prepared to deal with all the kinds of medical challenges that will present themselves this year. Well, joining me to discuss this extremely important issue is Dr. Andrea Friall. Dr. Friall is a trusted physician and the Chief Medical Officer for Tallahassee Memorial Hospital. Dr. Friall also teaches at the College of Medicine at FSU, not to mention the fact that she's also a practicing gynecologist. And later on in the program, we will be joined by Dr. Friall's daughter, Camille, who will share her concerns from a teen perspective. Thank you so much for joining us today.
Oh, Jane, thank you so much for having me. It's been quite a summer.
So let's start with what's on everyone's mind and how concerned should parents be about in-school learning, and what risk factors are there certainly for COVID-related issues?
So, Jane, all over the country, we're going back to school. And not only as a parent, but as a physician, I can't advocate enough to say that we need to protect our children. And to do that, we need to use the science and we need to use the recommendations from authorities that help us with the information that we have available today. And today, the information says that we should practice excellent hand hygiene, that we should socially distance, that we should vaccinate when appropriate, and that we should wear masks. And that does help reduce the spread of the virus. And we have these variants that are coming strong, and they are not letting up. Viruses mutate, that's what they do. And unfortunately, we have viruses that are mutating to be more virulent. So it's important that we pay attention to the experts who are trying to help reduce the spread of the virus.
But there's so many mixed messages out there, and parents, it's certainly from what I hear in the practice, are so frustrated, and they're looking for straight talk, and they're looking, in other words, how do they sift through the noise so that they can understand, and I hear what you're saying about hand washing, because we've been paying attention to that. But again, how do we sift through this so that we can get the accurate information dependent on the community?
That's why it's so important to really pay attention to leaders that are studying this information and putting it out there. Mm-hmm. When you're sifting through the noise, you should look at reputable sites, not your Facebook page, not Twitter. As much as I am guilty of thumbing through all of that information also, I have to make sure that I'm doing things as a physician. I know better. I know what sources to look for, but not everybody has that ability. But just like you look to your accountant for advice and you look to people that are professional within that arena, mm-hmm. you should trust the science and trust people that are reviewing this information and making it as noise-free as possible. The difficulty, though, Jane, as we know, is that the information changes daily. And when things change rapidly, then you feel a sense of insecurity and
uncertainty. Right.
But find someone that you focus on that is giving accurate information, whether it's the American Academy of Pediatrics, who is the governing body for pediatrics, for the pediatric specialty. If they're giving recommendations, that you should follow those. Or take into account that at least people that are giving these recommendations have researched it, looked at the peer review, are trying to make the best information possible available so that you can make the best choices.
It's interesting because here in Florida, of course, we have unbelievable numbers in terms of surge of cases. I'm a parent. I'm sending my child back to school. What do I say? Do I say socially, stay away from them, stay out of crowds where they're screaming? I mean, are there some specific things that I can share with my child to say, keep yourself safe?
The guidance really hasn't changed. We've added to our arsenal vaccines for eligible children that are 12 and above. But with respect to the recommendations from pediatricians and the CDC has always been that it's safe to mask children over 2 years old. So yes, you can play safely together. You can participate in sporting events, and you can do all of these things. There are always different, depending on the region that you're in. There's testing that is put in place to try and keep kids safe. Also, being honest about whether you're having symptoms so that you don't spread the disease. So it's very important to kind of stick to those, be diligent about sticking to, making sure that if you have symptoms of COVID that you stay away. And
It's interesting you mentioned the term being honest, because so many teens who have been isolated over these last year, they don't want to be honest. They don't want to say I've got these symptoms because they have such a need to be with their peers. So, I think that's an important point. The other part, though, is that we have seen an increase in mental health issues. Are the hospitals seeing that as well?
We do. And, mental health issues typically present mainly outpatient or in the physician's offices. So I will say that more than just in the hospital setting, you see it more in your private practice. And as a gynecologist, I do feel like I spend a majority of my time addressing anxiety and depression. And, patients don't know where their next check is coming from, and they're highly insecure about what they're going to do with their children if they get quarantined and aren't able to go back to school. So these are very big life stressor situations, which you treat these women and men. And so that is a very challenging for the medical field already, who is challenged with just doing their own specialty, on top of that dealing with the mental health issues that we have to help our patients through.
Okay, well, we've got so much more to talk about. We're going to be right back. You don't want to miss a minute of this very important conversation. Welcome back. We are here with Dr. Andrea Friall, Chief Medical Officer for TMH. A thought just occurred to me. You've got an exceptional reputation as being Chief Medical Officer of a major hospital in a major metropolitan area, and you're a woman of color. There's got to be just so few of you out here. What's your sense of getting there, and what's it like being in that position?
Jane, my journey has been special. I've truly enjoyed practicing medicine, and a lot of times we don't see ourselves in administrative roles. There certainly aren't a lot of women in the CMO role. However, there has been a shift in women accepting and walking in that door when it's offered or they see that opportunity. It's really important for us to kind of step out and show people that you can practice medicine as well as being in administration. And so, yeah, the numbers in the C-suite are certainly not what we would like to see. As more and more women step out and feel that they can also serve medicine by simply administrating as well as clinical practice and get fulfilled in that role, you'll see more women participating.
Step up.
Yeah.
I'm glad to hear that. And I've got to stay on track, because this whole medical crisis, I'm interested in your history, but this medical crisis is so significant. That should families, for example, find their teenagers, because this is what From the Heart is all about, hospitalized, what should they expect? For a while there was healthcare providers taking care of their kids. Can they join them while they're in the hospital?
Sure. Nationally, it's been such a traumatic process with COVID and limiting visitation. And whether you're in New York, whether you're in California, Florida, Georgia, the reality is the same. You're trying to protect your loved ones. And so typically, though, they do make exceptions for children, and you can have at least one caregiver with you. And I advise people, that support person is very important. We term them visitors, but in my mind, it's really your support person and your advocate that's there to take care and to make sure that your needs are being taken care of. So if I had anything to ask of anyone coming to visit their family member or loved one in the hospital, would be not to be a visitor, but be someone that can advocate and help, because that's really what the healthcare providers need right now. A lot of times visitors will come and have lunch and just sitting around, but they need to be there to help and engage with the patient. Absolutely.
All right, so what you're saying is that some of the policies from last year have shifted a bit. that at least, you can have one person there with you.
Absolutely. It shifts, unfortunately, based on the positivity rate within your area.
Within the community.
So if the community is surging, you got to shut it back down. But as the community opens up, like we just had the ability to have 2 visitors, or at least 2 visitors at a time, and you can switch out. You can't do that. It causes too much possibility of bringing infection in when you're doing that.
When it comes to Black and brown communities, of course, we know that there are huge disparities. What are you finding in terms of those that are coming into the hospital? Are they having access to, equal treatment, or is there, historically, I've always been concerned about our community being able to get, the full range of experiences.
Actually, there was a recent article, and that's interesting that you say that, because, as healthcare providers, first, do no harm. I should see you as your risk factors, but not as someone that I would triage differently because of the color of your skin. Right. I should see you and say, oh, Jane is at risk for X, Y, and Z because of her weight or her height or her habits. Not that I'm here to punish or judge or treat. So an article was about whether patients who are unvaccinated should be treated the same way as patients that were vaccinated, and I find that absurd. We all make choices, poor and wise, but as a patient, you are treated because you need treatment, and you're triaged based on the severity of your disease, not by your choices.
Okay, that's good. That's good to know, because I think a lot of us are frightened about the possibility, and will there be a differential? And what you're telling me is that there is no differential.
There should never be a differential.
Now, from again, I'm a parent. My child is in the hospital. What are we looking at? Is there an average stay, or is there an average course of treatment, or is it, does it depend? Is it idiosyncratic? Does it depend on the individual?
It depends, because remember, especially with COVID, the severity of the disease is what brings you to the hospital. That's why the hospitalizations for children are becoming more concerning. With Florida's on the news nationally with having over 200 hospitalizations for children, which is more than during the height of the pandemic earlier. So what makes that concerning is that you do tie up, that causes patients to be on ventilators. So these are the sickest of the sick that are hospitalized. So that doesn't even speak to the number of positive cases that are out there. So you have positive cases floating around, and then you have vulnerable people that end up in the hospital. And those hospitalizations can be 14 days, 21 days, and even longer.
Welcome back. Well, as we said, we're here with Dr. Andrea Friall, and joining us now is her daughter, Camille. Welcome to the show, Camille.
Thank you for having me.
Well, listen, I am just delighted, because you know what? I want to get a teen's perspective on what your thoughts were returning back to school. You must have had some concerns, because teens, they're pretty carefree.
I was definitely concerned. This year, we omitted hybrid learning completely. So in our school's population, and I know a lot of other schools at least had maybe half or a fourth of kids coming back. So I was concerned, obviously, with maybe not everyone wearing masks, keeping everyone safe, not being vaccinated, or even just washing their hands and keeping clean. So it's important to remind everyone in our classes, and just to even wipe down their spaces. Teachers and students have actually been surprisingly good about it in the first 3 days of school.
Yeah, the first 3 days in this area, the first 3 days. Well, now have you seen any interesting responses by your peers? Any kind of unusual emotional responses? I know it's early in it's the first week or so, certainly around the country, but what's your observations?
Well, a majority of the kids actually are vaccinated and still do wear masks, because there is a mandate currently in place. But there are a few kids who do believe that wearing a mask is still an option, and they're not realizing the risk that they're actually putting all the people around them at. They are an extreme minority within the school's population, and most teachers still encourage, and they have masks on hand to their kids.
Oh, that's good. So right now you feel a relative sense of comfort. Again, but as a parent, when she goes out the door every morning, do you say, all right, Camille, this is what I want you to make sure that you're doing?
We did. Both Eric and I, we were, we don't have to, we're very lucky. She's very she likes to do the right thing. And I know that sometimes that can be difficult, but luckily she is able to kind of articulate and help others find their way in understanding that perhaps it's best to keep themselves safe as well as others. I didn't have to do a lot of preaching, and luckily I think the kids have, if the parents don't intervene, I think the kids actually make very good choices among themselves. It's sometimes, unfortunately, the adults that aren't being adults that are making it difficult for the children.
You know, Camille, there are usually so many other factors going on when you're going back to school. Sometimes we see bullying and we see unintentional meanness on the part of peers. But other times we see, a caring. I think coming back to COVID, though, what are you seeing at your school and what are you hearing about other schools?
I'm lucky enough to be at a school where it's a majority of people who are masked and the minority is not wearing masks and not necessarily following the CDC guidelines. But I find that at most schools, it's either one extreme or the other. Everyone's in masks and there are a few people without, or vice versa. And that really reflects how a lot of students treat one another. Definitely the majority tends to gang up on the minority, whether they are masked or not, just depending on their situation.
You know, one of the terms I use is COVID Central for several of the high schools because some students are so cavalier and others are so careful about it. And I think this represents what's going on across the country. You know, if you, obviously you're a talented kid, if you were to give advice to your peers with regards to safety, and of course you're the daughter of a physician, what would you say? What is the most important thing you see at this point?
Just be clean. Keep everyone safe, keep yourself safe. We all want to find our normal again. And the best way we can all do that is to be considerate to everyone around us.
Yeah, I think that's an important factor when you say be considerate, because if this is a time to pack your patience, certainly it's during this period. And you know, Andrea, some healthcare providers have said to me, and this is true, that we're looking at this over at least the next year. Are we looking at that kind of time frame?
Well, look what happened. Absolutely. No one has a crystal ball. But if we were to, at the beginning of the summer, say that we were going to be here right now, would you have thought that?
No.
No, because when everybody said, yay, we have vaccines, but there's a big rumble of, I'm not getting that. And then on top of that, you tell everybody, you don't really have to wear masks if you're vaccinated. And the people that aren't vaccinated say, well, how are they going to know if I'm not vaccinated? And so then you have this whole pool of people. It's like asking people to go in the big county pool and just telling the people that pee in the pool to stay in one corner. It's all going to be mixed together. And so having things that are not universal don't help.
There's one other point I want to cover, and is that there's still so many myths out there. You know, within the last week, I had 3 patients. I was actually fired from a case because I gave my opinion about fertility and COVID vaccines. There are still families who strongly believe that there are those consequences. What do you do with patients like that?
You know, I try to point them to reputable sites, and I try to counsel them appropriately. Even professionals within the field are going to have mixed emotions. You know, I'm a physician, but I'm also a mother, and I'm also human. But my job as a physician should never be to give misinformation. And so as much as possible when I speak, I should be speaking based on facts and scientific information and helping patients make their best choice. So when you're trying to talk about finding that sweet spot of information, it needs to come from a place of authority, and authority within the field that you're talking about. So if I'm a physician and a clinician taking care of a patient, you have to kind of meet them where they are. When you talk about vaccines in a non-threatening way, because the reality is we're not trying to vaccine shame. I need to understand where you are, because regardless of whether you get vaccinated or not, I'm still going to take care of you. But it would be easier to take care of you if you were able to get the vaccine, or if you were practicing hand hygiene, and if you were masking, and if you were following social distancing practices.
You know, when it comes to vaccine hesitancy, I think we're seeing it not only on the part of, families in general, but sometimes even healthcare workers. But we're going to talk a little bit more about that when we return. thought just occurred to me, Camille. You're going to be going back to, football games, homecoming. They're going to begin to resurrect some of these kinds of events. How's that going to work?
Well, the Student Government Association, which I am a part of, is in charge of all of these events, and it's a real challenge because everyone's back in person, which means everyone now has this new demand for wanting this social year that we all lost last year. But it's very important for us to find safe ways to do that. So we're trying to distance and have it smaller, maybe have one for upperclassmen and underclassmen.
Well, that makes sense.
But you still have to stay safe, and you still have to mask, and you still have to sanitize and be clean. But we're just trying to find the best alternative. I will be going. I did miss a huge chunk of my freshman year, and it's almost like being a freshman again. But I will only continue to go as long as I know I can be safe and keep the people around me safe.
So if your mother, being in the medical field, all of a sudden says, you know what, we're going to put some of last year's policies in place, do you think a lot of your peers will be resistant to that?
I think there would be some initial resistance.
Right. And what's your sense, in terms of moving forward and healthcare providers' message to families across the country? This is going to be, at least my sense, is going to be a turbulent year.
It is. As we are climbing to the top of this peak, we look forward to the downside, and we would hope that we don't have another peak. And it is going to be very important for us to have a consistent, safe message. Yes, we all want to go out and have a good time. But while you're doing that, it may require us to wear masks indoors and follow guidelines, but you can still have a good time. And if you follow the rules and if you are able to kind of get back out there, I think that our mental health will be much better. We don't have to be fighting over this. It's actually very silly. A lot of us have been having a good time wearing our masks, getting out into public. Our economy is suffering because we simply are not following rules that could really have turned this around months ago, in my opinion. That's my personal opinion. But professionally, I just can't say enough that it is really important to follow the recommendations of the CDC. And as they may change day to day, so does the information available to us. And we're simply just trying to provide you with the most accurate information possible to get us moving in the right direction.
And I think that's what you're saying, that we all have to be flexible and ready for the new information as it comes out. But we also have to stay on top of it. And so I want to ask one final question for families of color, because a lot of times we don't have that access to information. So how are we getting that out to them? Are we doing it through hospitals, through community centers, through churches, or all of the above?
All of the above, Jane. And I mean, I'm not above using my daughter, obviously, but we need to get the message out, and you need people to get it. You have to put the faces that are trusted in your community in front of them. It may not always be the right way to do it by just saying from the very top of government, do it this way. You need the people that are in the churches that you see every day, that your teachers, your physicians, that are trusted, who are citing accurate information that is backed by facts to help you make these decisions. So, although everyone sometimes doesn't agree, a consensus is what we need to come to, and that's the only way we're going to push forward.
I think what Dr. Friall is saying is that it takes a village to heal a nation, and that's what it's going to require. And so from the heart, we know that this has been a very special conversation today, and we look forward to seeing you next week.